Welcome to our viewers and NAHSE members. My name is Raven Brewington, and I'm the Northeast and Midwest Public Policy Chair for the National Association of Health Services Executives. NAHSE has evolved to become the premier professional organization for Black healthcare executives. Our 31 chapters participate in local and national programming designed to improve quality and access of health services to our communities. We also provide educational opportunities to those in the field. As a member of the New York Regional Chapter, which is one of the original founding chapters of NAHSE in 1968, I want to share some quick history to you about Mr. Everett V. Fox. Joining New York University's Medical Center back in 1965, he eventually rose through the ranks and was promoted to the Vice President of NYU's Medical Center, as well as an associate professor of hospital administration at NYU. His esteemed contributions in healthcare and role as the first president of NAHSE eventually led to the creation of the annual Everett V. Fox Student Case Competition during President Kevin Lofton's term. NAHSE continues year after year to educate students, early and mid-careerists, as well as our senior level leaders, to put our thumb on the pulse of healthcare. We not only take pride in this knowledge, but we want to ensure and continue to provide those educational opportunities for our members to be able to better lead in their communities. Today, I'll be interviewing Dr. Carla J Sampson. Dr. Sampson is a clinical associate professor and director of the Health Policy and Management Program and online Master of Health Administration program at NYU. Dr. Sampson is a board certified in healthcare management and is a fellow of the American College of Healthcare Executives. I'm also proud to say, as a fellow alum, Dr. Sampson was the Director of Health Management Program at Temple University. Dr. Sampson previously served as the Vice President of the Commission on Accreditation of Healthcare Management Education, better known as CAME. She continues to strive for excellence in education preparation for all of our future leaders. Dr. Sampson was awarded a PhD in Public Affairs, Health Services Management from the University of Central Florida and earned an MBA in Healthcare Management as well as Master of Science in Healthcare Financial Management at Temple University. Thank you for joining me, Dr. Sampson. We are honored to have you for this essential conversation as NAHSE truly hones in and stresses the importance of the census to our members, family, and friends across the country.
And thank you, Raven, for asking me to spend this time with you this afternoon. I'm really excited about our conversation this afternoon.
Thank you. And as a reminder to our viewers, every decade, the census determines funding that directly correlates to our daily lives. So billions of dollars are distributed annually to support transportation, health services, housing, public safety, educational programming, national disaster preparedness services, both federally and locally. Completing the census is crucial to estimate population density and the potential for spread of communicable diseases, which is especially important now during the COVID-19 pandemic. Completing the census will help account for those essential programs and services to address the various populations we see across the United States. So we'll get started. As we mentioned, the U.S. Census takes place every 10 years. This year appears to be more critical than most. Given the COVID-19 pandemic and upcoming elections, why do you recommend people complete the census?
So that's a very good question, Raven, and thank you for asking that question. Even if this year were not a sentinel year for so many different reasons that we could enumerate, we should always complete the census. The census is put into the Constitution so that we can have an accurate count of populations. This is the only time that we go door to door to figure out where people are. And so we use this information at all levels of government and business and policymakers and evaluators, as well as researchers rely on this data to really get that full count of where people live, how old they are, and what are their races and ethnicities. And this is the only way that we can get this information. And other people look at the census as, why do they want to get all up in my business, in the way that we would say? But the information is only reported in aggregate, and personal information is embargoed for 72 years. So no one is going to go through that information and pinpoint your information. And it contrary to all the rumors that we heard going into the census this year, it doesn't ask citizenship information. They tried it, it did not work. So whatever your immigration status is, you are a part of the community. And so you're relying on the same infrastructure and the same services. And so we need to make sure that we're counted so that everyone can get a fair share. And then based on the census, that door-to-door census, we then have the American Community Survey, which is a sample survey that goes out, takes a monthly sample of all the households that were counted in the census. And this follow-up survey gives us estimates of more detailed questions that are in the census about income and educational attainment and even your access to the internet. So it provides a rich context of information for researchers like me, and it gives us an estimated insight into the population. So really, put another way, the census is our version of asking, who all is over there, right? We need to have an actual count of who people are and where they are on their general description so we can cater to them for the next 10 years.
Absolutely. And for us, since we're planning hospitals, nursing homes, clinics, other healthcare services, and that's included in the census data, are you able to share something, an insight on how our colleagues in healthcare are truly being affected by those responses, or how that census data impacts healthcare institutions?
So planning is really one good way to think about what we can use the census data for. It is really the starting point of understanding the population and the demographics of that population so that we could then make strategic decisions about service line planning or what services to offer and even where they should be placed. So data from the census could also inform other sources of data that we could use to complete the community needs assessments as required by the Affordable Care Act. So if we really are to continue our shift to keep the people that we're serving well, there has to be a source of original data to figure out, okay, who are the people and what are the demographics of that population? Some of that information comes from the census, some of that information comes from the ACS, but it is really the starting point for all planning. So we must have that information.
Absolutely. Do you think there's a way that maybe we can do that more often as far as collecting that information?
Well, think about collecting that information. It really is labor intensive. I know that the technology is helping us in terms of we're getting the notice in the mail and you can complete that and mail it back. You can fill it out online, but there are those people who will not do that, or it will get misplaced. So people still need to go door to door to make sure that the information that we're collecting is truly accurate. And we even have people on the back end who are calling to follow up on information for some responses that we have. So it really is costing us a lot of money. I don't see a way that we could do it more often. In fact, it is embedded in the Constitution. Every 10 years we need to do it. But the ACS is the way that we get more regular intervals of information, because the American Community Survey, ACS, is one that is an ongoing survey. So they take a random sample of people, send them out this information, collect the information from them, and that keeps going on and on. So we kind of keep getting a good count and background, more in-depth profile of the information that we collected from the census.
That's very useful as well. So what would you say your thoughts are on the census assisting in eliminating health inequities while examining those social determinants of health, recognizing that people on the margins truly do matter?
So, I'm kind of glad you asked this question, because what is one of the questions that is on the census, not on the ACA so much, but really on the census when we count, it asks us where we live age, race, ethnicity.
Yeah.
In my mind, if we think about the social determinants of health, everything comes back to race. So that's something that is collected on the census and helps us understand in terms of planning where people are and how we can affect the other determinants of health that could result in better health outcomes. And some of those things you mentioned at the top, which is making the decisions about planning for housing and transit and community safety, where do schools go, where hospitals go, where clinics go. All of that information is then based on the census data, which then can inform how people have access to care. But then it's also about the quality of the neighborhoods in which they live, where schools are placed so people can get the education that leads them to have the jobs, that then gives them the income, that then gives them access to insurance, so then they can keep healthy. Everything is connected back to, really, to my mind, the underlying structure of this is about age and race, and that is the critical information that's captured in the census.
Thank you for that. So because of right now, today, in the wake of COVID-19, we've seen the rates of homelessness fluctuate tremendously. How would you suggest that we better account for those populations who are less likely to be counted by the census, since we need that data?
Yeah, and this is not necessarily my area of expertise, but this is, I understand it would be very, very tricky, because if you think about the census, it is tied to an address, right? It is tied to counting households where they live, but we know that not everyone is fortunate to have a place that they can call home, but they matter too, right? So I know the census makes some concerted efforts to count the people who are not living under roofs, but maybe in shelters, who may be going someplace to get meals, who may be living on the street or in some other encampment. But think about the investment to get to count those people, some of whom may or may not have other illnesses, mental conditions that they're not getting treatment for, and how we will count that. So it is something that's very difficult to do, but admittedly, it's something that they're working to collect it. The other part that I think the census can help us understand is, we know that people of particular races or ethnicities really do live in intergenerational homes, and we're not able to do the social distancing, or we're working with people who are now considered very essential, and thank you for serving now in this time, we need you. And so understanding how people are living, particularly in New York, could then inform housing policies such as, really, guys, we need to have more affordable housing in the city. People are getting displaced more and more. People are having to move further away from work. People have to travel even longer distances to get to work.
So many people don't realize that the Electoral College is determined by the census. So this ultimately can decide how healthcare policies are made. So what are your final thoughts regarding the importance of not only completing the census for an accurate count, but ensuring people are registered to vote and make sure that your vote counts in every election?
So let me come back to apportionment, as in how we determine representation. But voting is so critical, and I don't mean voting when we have to vote for a new president, but I mean voting in every single election. As I have been telling my friends who brag, and I guess I know some of those people who do not vote, but voting is civic engagement. Without that, you don't have a voice in who represents you at the state level, at local levels, at federal levels of government. And by doing that, you then take ownership of what's happening in the places that you live that affect the people that you love. And so this census really would have a lasting impact on how we distribute seats in the House of Representatives, because how many congressmen you get for your state or area is determined by that population. And we know that the population shifts are trending, that people are leaving the north and moving south and west. So we may lose some congressional seats in the north, and states in the south and west may pick up seats as well. And if we think about that map that we see on election night, and we think about those colors, for example, it means that the people who represent those states that are a particular color would then direct policy for all of us. And we only have to look back to the fights over Medicaid expansion to understand what that might mean. More people are going to fall through the cracks if we still think about everyone needs to pull themselves up by the bootstraps, the proverbial bootstraps, right? But that is not always true. There are real structural differences and barriers for people, particularly people of color, that we need to address. And by looking at it in that way, we can see how important it is to vote so that the people who are representing you represent your interests. We could talk a whole lot about the dark money that's coming into the elections. And I have a whole rant that I do for my friends about that, but I don't think we have time for that this afternoon.
That's okay. We'll have to schedule another call for that one.
Yeah, I'll be up for that. This is fun.
Absolutely. So if you can, any final words at all between the census, COVID-19, essential services that we need in this country, things going on in New York, policy, anything at all that comes to mind?
Well, here's what I tell students in class. Here's what I've been saying this semester, that November could be a sentinel event for us, and that I'm hoping that after November, we get to a place where we understand that healthcare is a basic human right, and then we get back to the work of doing the reform for what healthcare means for us. Because COVID was very illustrative as the disparities that still exist, and that healthcare, whether or not you have it, whether or not you have access to it, is a function of the kind of job that you have, is something that is not right for a first world country. And I interrogate all these things as an immigrant myself. So this is something that I think that we have to do a much better job at, so that we can all have the quality of life that we're due as Americans. And it's not until we figure out that we have to take a collective approach to making sure that everyone, every American, no matter color, race, creed, wherever you come from, really does have a shot at the American dream, and it won't be for something that you just hear about, or some illusion that is just out of your grasp and you can't figure out why. Those are some of the things that we need to start working forward for. Those are some of the things that would really make us, well, truly all American.
Yes, and I will say this is so important. It really outlines why people on the margins matter. And I took that takeaway from you. So
Yeah.
Thank you so much for your time, Dr. Sampson, and enriching this discussion about the census, healthcare policy. NAHSE truly continues to commit combating healthcare disparities. Our members are dedicated and morally obligated in promoting efforts towards completing the 2020 census. Chapters right now are supporting initiatives across the country to increase community participation, and that deadline was extended to September 30th. So that's in a few days, and we hope you truly use those resources wisely and take advantage of this time. I also want to share with everyone that New York Regional NAHSE does have an upcoming program to go more in depth on the census. We'll have Kendall Johnson, who's the Executive Director of the 2020 Census from the U.S. Census Bureau, as well as Lisa Moore, who is the Assistant New York Regional Manager for the Census, and then Marilyn Sanders, who's the Chicago Regional Director. So that's a great conversation. We hope to see you there as well, Dr. Sampson. And tune in. This is a great conversation. We'll have to keep it going soon.
Yes, we must, because the work is not over, not by a long shot.
Thank you so much.
All right. Thank you, Raven.
Thank you.